What does it say there? I'm a healthcare voter? Is that what that? I'm a healthcare voter. Okay. Well, hopefully that means you'll vote with me. And the reason for that is this. I was in my office one day, and one of my friends came and said, you know, Mitt, why'd you run for office? And I said, Tom, you know why I ran for office. You've heard me talk about the reasons. I said that I ran for office because I want to help people. And he said, well, if you want to help people, you'll find a way to get everybody health insurance. And I said, Tom, that's impossible. I can't get everybody health insurance. I don't want to raise taxes. I don't want to have the government take over health care. I can't get that done. He said, well, if you really want to help people, you'll find a way to get it done. And so I let that gnaw on the back of my head, and after several weeks or months, I finally said, you know, I want to see if I can't do something about it. I pulled together a team of people, not just government folks. I got a head of a consulting firm in Boston, a old venture capitalist partner of mine, an executive or a principal from Morgan Stanley, the investment company. I got some actuaries. I got a professor from MIT. We came together and looked at healthcare. And after a couple of years of work, we found a way to get everybody health insurance without requiring a tax increase, without requiring a government takeover. We could find a way to get all of our citizens health insurance. And I'm proud of that. It's one of the things I'm most proud of my 4 years in office. We broke the paradigm. We found that we could actually solve a problem like this. Oh, it may not be perfect. There may be down the road needs to improve it in various ways. I noticed other states have adopted certain portions of it. I hope they come up with ideas even better than ours, because the states are the laboratory of our democracy. And after states have tried it one after the other, we'll perhaps find a way to get everybody in the whole country insured. That's the objective. And we'll learn and learn. And at some point, we'll say, you know what? We've now learned enough lessons that this can be nationwide. We found ways to make this work in every state. And I don't know that that has to be mandated by the federal government. I sure hope not. I think state by state will find ways to make it work in their respective states the best way. But here was the key for us. We found it was important to take mandates off of the private insurance companies so they could offer products that were lower priced that people could afford. I wanted to take more mandates off than my legislature did, but that was just a disagreement between us. I want to get the premiums down. I wanted to allow people to own their own health insurance. It doesn't make sense to me that if someone worries about losing their job, they worry about losing their health care, particularly if they have a pre-existing condition. They lose their job. If they lose their health care, they're going to be in a real tough shape. So I'd like people to be able, if they want to own their own policy. And the president just proposed recently that if they do, they should get the same tax treatment a company gets. It should be paid for in pre-tax dollars. That makes sense to me. I also think we have to bring some market dynamics into health care. And I know there are a number of conservative folks like me here. I've found that the market works. Almost any place you can insert market dynamics, it has a very positive effect. And in health care, we have right now a setting where the people who are getting health care, by and large, don't have much of a stake in how much it costs, because it's all being paid for by the insurance company. We opened the door in Massachusetts to something called co-insurance, which allows people to buy an insurance product that says, hey, I'll take care of 5% of the bill, up to, let's say, a maximum of $500. That gives the individual an incentive to care how much the provider is going to charge for the service. We also put on our website transparency. We show what hospitals are charging, and we rank them in terms of their quality. These kinds of features, I think, are what's going to help get health care for all of our citizens, and it's something which, frankly, we've got to do.